Good evening, everyone. And today's topic is about what is a review article. There are a lot of different types of review articles, and what everyone means. What actually each one means. That is what is the basic idea of today's video. So, always welcome to my channel, Pain Free Partha. Subscribe, listen, and enjoy. So, whenever I talk anything on academics, I put a big salute to the legendary teacher of 2 centuries, in our institute, Mahatma Gandhi Medical College, Sri Balaji Vidyapeeth, Pondicherry. Now, what is a review article? A review article can also be called a literature review or a review of literature. It is a survey of previously published research on a topic. It should give an overview of the current thinking on the topic. Unlike a original research article, it will not present new experimental results. Okay, now if you are writing a review article on some topic, for example, you say intrathecal opioids, okay, intrathecal opioids, or about nursing influence in palliative care, or something related, even if it is related to biosciences, whatever it is, Internet of Things, which is useful for household safety, something like that. You already there are published articles. You are making a survey of each article and telling something. This is what is called review article. Okay. Now you are not telling I have got this evidence, 10% of the cases of this, 20%. No, that is not an original article, it's a review article. Now, there are various types of review articles. Now, you can see this is narrative review, historic review, systematic review, meta-analysis, umbrella, mapping, synthetic, scoping, mini, state of art. So there are so many reviews. I will tell two sentences about each of the things, differences, and the importance of each reviews. Okay. Now, what is a narrative review? Narrative review describes primary studies without an integrated meta-analysis. Okay, now you are going to write something about whatever the epidural anesthesia in labor with opioids, something like that. It is some 15-20 studies are there, out of which you are synthesizing something, nothing like that. It simply tells these and these are the evidences, and Gopal et al. Has told like this, Sharu et al. Has told like this. This is what is called a narrative review. Okay, narrative reviews are useful for medical educators and researchers. Okay, now very important. Narrative review addresses a broad question. It addresses a broad question. It doesn't focus into a small research point. It addresses a broad question. Okay, that is what is called a narrative review. Now you can see nerve blocks of the head and face. This is a narrative review only, but because after the narration, it describes some cases and inculcates some of the review things into that. So it becomes an interactive narrative review. Okay. So it's a narrative review only. Whatever has happened and whatever has told about the different nerve blocks of the face, it is just telling, but it doesn't synthesize. It's like a systematic review or a meta-analysis. It tells what all has happened. Okay. So this is a narrative review. And there are a lot of scales for narrative review. Sandra scale. For example, description of the literature research, referencing, scientific reasoning, appropriate presentation of the data. If all these things are not there, it is not a good narrative review. Before taking up the subject of what is going to be a narrative review, all these things. Is there a concrete aim? Is there a good description, literature research? Is there proper scientific reasoning? All these things. This is what is called Sandra. Now we will go to historical reviews. The historical reviews development of an area of science. Chronological order of studies. Now, for example, if you are writing a narrative review and you are blocking like a neck face blocks, your maxillary block will come 2023 and your mandibular block may be 2021. So this is a narrative review. But historical review means it goes in the chronological order from 1960 to 2024. That is how you should develop a historical review. Now see, for example, if you take some point, now you want to write, for example, overview of how an anesthesia machine has developed. Okay, now there will be 5,000 articles. We cannot say historical review by going on seeing all the 5,000 articles. Now then you can have not article jump. You can have renowned authors. You can have renowned journals. For example, I will take only from Scopus and Comment. I will scope or take all from these renowned authors. Okay, then you can write an historical review. Now, what is your focus? And make it as coherent and logical. Now you see historical development of the anesthesia machine from modern to the integration of mechanical ventilator. Now you can see the discovery of insulin from Benting and West, how we have come to deglutic aspart, all these things. So the discovery of insulin. Now it was in 1921. 100 years have gone in insulin. Another 3-4 years have gone. Dr. Ravi Shankar's word, a pretty big salute here again. Unless you know the past, you cannot make advances. This is what is the importance of historical reviews. Now we know what is a narrative review, what is a historical review. Now we will go to the most important thing, systematic reviews. Systematic review may be only systematic review, or it may include meta-analysis. Systematic review and meta-analysis, what we call as SRMA. Researchers call it as SRMA. Systematically analyzing studies related to a set question. You see here, narrative review was a broad thing. Now systematic review is a specific question. And synthesizing results using strategies that reduce bias and random errors. Okay, this is what is called systematic review. Now, in anything, if you want to write a systematic review, you should register in Prospero. Like something we are registering RCTs in CTRI, we have to register in Prospero. Now you can see here CRD, this number registered on 12/8/2024. When the CRD number is this systematic review exploring the impact of acute pain of these things. This is my login ID. Now you can see awareness and utilization of palliative care. Again, I see my ID, registered biomarkers and orthopedic oncology. So this has got some 41 questions. Why are you doing this? What is your inclusion criteria? How are you going to remove the bias? All these things, animal or human, what all these things we have to fill it up and we have to submit. The team will usually see that, and if it is according to the PUCA details, it will register and give a number like this. Clearly define the question. This review has a specific research question with inclusion and exclusion criteria. So rigorous research, both published multi-phase screening, independent screeners to perform a blinded screening. It extracts data from included studies and systematic review software. The review analyzes and interprets the results. It excludes bias. Then it reports for publication. Now, exploring the impact of nutrition on acute pain. Now you see the question is clear. Does a nutrition impact a cancer pain? Something like that. Okay. So this is the question. There is no broad base. This question has to be answered. And this is published actually before. Now then, after taking a research question, you take it as what are going to search? PubMed, Medline, Embase, Web of Science, Cochrane, Google Scholar. What are you going to search? Randomized control trials, reviews, feasibility studies, case series. No, I'm not going to study animal studies. I'm not going to study in vitro studies. All these things have to be clear. Then MESH. words you have to search: nutrition, diet, micronutrients, macronutrients, acute pain, management, nociception, analgesia, pain relief. All these words you should put, then start searching for articles. Now there may be 1,150 articles, out of which there are 320 duplicates, so many things excluded and reports not reviewed, and you get clearly your inclusion is around 37. And this is what is called Prisma statement. When you start writing the systematic reviews, you should give a Prisma statement. Now, as if you are going to give a Sunstar statement for RCT, Prisma statement for systematic reviews. This is an extension of Prisma. For example, database name, multi-database, study registries, online sourcing, citation searching, all these things we have to be clearly given in the methodology. There are a lot of Ryan software for faster systematic reviews. You can use Damovi software for meta-analysis. Now, we have written a systematic review. Systematic review has got an inclusion criteria, exclusion criteria, so many articles searched. It assesses a specific question. Okay, it assesses a specific question. Now the meta-analysis is, so for example, 1,700 patients. Now we have taken 10 RCTs, 10 each, 150, 150, 200 patients. Now we are synthesizing this data and putting this thing without bias. This is what the software of systematic reviews does by putting a meta-analysis, telling that this drug, ondansetron, is better than metoclopramide in post-operative nausea vomiting by way of meta-analysis. Now you see efficacy of peranostetron in comparison with other HDs in preventing after. This is not published yet. Now let's move to the meta-analysis. Now you can see here odds ratio, favors, not favor. There are so many articles we have traced and on this. Now, what actually does it for long term extension of 24 hours, peranostetron is better. And before 24 hours, peranostetron, ondansetron are equal. This is what is the concept which I have. I have been using peranostetron for years together. This article is under the review process in a Scopus journal. Meta is a name given to any subject that analyzes the same thing to the higher level. This is what is meta-analysis. Summarize research to guide future studies. It's a pooled estimate. This is what is a simple thing. It's a pooled estimate. Now 5,000 patients, because we have analyzed 40 systematic reviews, or we have analyzed 40 articles, 40 randomized trials, and you have pooled it as an estimate to give a result. This is what is called meta-analysis. Now we have narrative reviews, historic reviews, systematic reviews, and meta-analysis. We will go to what is known as umbrella reviews. Umbrella review summarizes findings of previous reviews. It is not findings of previous RCTs. It is not synthesizing and summarizing previous studies, research work, original articles. It is a study of previous review articles. Now there are 10 review articles on some subject, okay, on epigenetics and Parkinsonism, on plant medicine and diabetology, something like that. All these 10 reviews it takes and puts up what all the things in that trust and umbrella review. Growing number of systematic reviews, because everyone starts to write SRMA. So there are a lot of SRMAs. Each journal publishes 2 SRMAs every month or every issues. So we have so many SRMAs, and this causes so we need an umbrella review to synthesize this review articles to give one. This is what is individual study, this is systematic review and meta-analysis, and this is an umbrella review. Now this picture will give what is what. Now there may be sometimes we will not know how to go about with a systematic review. because the research is enormous. We can have mapping reviews. It will find out the gaps in the topic area. Okay. Now, economic evaluation of cataract is systematic mapping review. Comprehensive quality of life mapping review, because quality of life in diabetes children mapping review, because we don't know how many articles are there. Yes, we do a mapping review and find out what is to be taken, what is the question to be done, and focus clearly on this to write starting a systematic review. Now we know systematic review, scoping review is coming, mapping review, we know umbrella review, we know review of reviews. Now, scoping review is systematic and transparent, may not assess quality of the studies. This is a very important point between SMA and scoping reviews. Scoping review will say that these are the things which has been coming out from these articles. But systematic review will analyze the methodology. This is what is the problem with this research. That is what is the problem with this research. Sometimes SRMA writing author will write to the author of the article, what was the exclusion criteria in your article which was published in 2013. So may have limitations. Scoping reviews can be durations. The quality of life and diabetes in India. Now you see purpose and overview of the available. It summarizes the evidence, unbiased evidence, uncover international scientific methods to find and summarize research. This iterative approach means, what is this? Again, go back, go back, go back, go back. This is what is called an iterative approach. Here, there is a scientific method to summarize the research. Now, this is about scoping versus systematic. Now we have scoping versus mapping. Topic based, again I'm telling you, something like scoping review is like narrative review in a more systematic manner, but mapping review is question based. Chart the data, collate and summarize the data. The scoping review of how to make hospitals, health literature, healthcare organizations. Now we know what is the scoping, umbrella, systematic, meta-analysis, umbrella review, historical review, and narrative reviews. We will go to the one more term called synthesis review. See, after reviewing so many articles, we found out that this may be the cause of this. You synthesize a new thing. Okay. Now you can synthesize a new thing. Now, after so many articles on genetics and some ischemic heart disease, something like that, you synthesize something like this genome variation may be the cause of this, because there are a lot of studies which goes with that. So you synthesize a new point. So this point is getting evolved. This is what is called synthetic. Now we have found out local anesthetic drugs in populated for diabetic neuropathy. Already nerve is gone. If you put nerve here, but local anesthetic here into the nerve, what will happen? It does no harm. That is, we have read so many articles. This is our article only. We have read so many articles and we have synthesized that putting local anesthetic into the nerve, which is already damaged by diabetes, does not do any other more harm. So that is what we have synthesized in this review. Now I have told this is a synthesized systematic review. This is basically what we have found out is yet to be published. It will be published in few days. Now this is retinal. Normally diabetes will cause retinal damage. Now what we are going to synthesize from this, we have taken a lot of articles and find out retinal damage can cause diabetes. Retinal receptor dysfunction can cause hyperglycemia. This is what we have synthesized from reaching and reading a few articles. This is what is called a synthesized review. Now, what is state of art review? State of art review is a type of literature review that a comprehensive overview of the current knowledge. It is not historical. It is not narrative. What is the current knowledge about this? What is the current knowledge about this? This is what is important in this thing. For example, if you are going to create a drug, what is the use of artificial intelligence? Do the state of art. Now you take 5 articles, 7 articles, 10 articles, and write a review. In a drug discovery, the use of artificial intelligence. In a drug discovery, what is the use of artificial intelligence? Is one of the state of art review. New questions, new thoughts, new researches. This is what is called state of art review. New genomic techniques, state of art review. Physiotherapist-led approaches to safe aging in place. For example, old age person will fall. Now, what is the state-of-art physiotherapy techniques that will decrease falls, that will produce safe aging? All these things is state-of-art review. There is something called clinical review. Now we have adrenaline and anesthesia, a clinical review, which is, see, for example, adrenaline and is used in anesthesia in so many things. 1, 2, 3, 4, 5, 6. What are the things used? How it is used? What are the references for this? Now, important to clinically utilize this is a clinical review. It's mostly of a whether a freelancing practitioner can read this, a person who is not very good in intensively knowledge in this can read this, or a postgraduate can read this easily and get an idea. There are many reviews. Simple. I don't want to say narrative review like 40 articles. I want to read only 10 articles and put the synthesis like this. So many review. Insights the role of TRP channels in retinal circulation. Important effective medicinal plans to treat hypertension in ethnobotanical evidence of era. Many review. This is anesthetic management of patients presenting. This is a review article. This is a management of patient eclampsia. What is this? Is written by us. But this is something like clinical review. Now you see, there is one more thing you can see. So postgraduate educational review. This is a type of narrative review only. But it is very simple, clear for a PGs. So we have named it as postgraduate educational review. Now we can see health technology in the management of rheumatoid arthritis is systematic review. Now what is important in medical is systematic reviews and meta-analysis. So we know what is systematic review. What is more important is, number one, we should get registered in this Prospero. Number two, we should clearly state the principal statement. These two things are important for systematic reviews. Thank you very much. Thank you.